Julian gives such a personal and important response to that question. But in this country, we're seeing a shortage of primary care physicians. And I know you look at this around the world. What's going wrong here?
Well, what I would say, I came into this role at USAID where my job is to lead foreign assistance for global health outside our borders, but I'd come from 20 years of working on how we advance health systems everywhere, including in the United States. And one core thing that I've seen is the relationship between survival and income is generally extremely tight. It's like, it's almost one-to-one.
Personal income, and so?
Yeah, the country's level of income, so the average income in the country.
Okay.
And so the more a country makes, the more people survive. But there are countries that are outliers on that scale. The U.S. is one. We're underperforming our income.
Right.
But then there are countries that are vastly outperforming their income. You wrote about some of them recently, and your series on life expectancy is fantastic.
Thank you.
An example of that is you talked about Portugal, 82-year life expectancy with a fraction of our income in the United States. Right. We peaked at 79 in 2015 and have been going down ever since. You had a chance to talk a little bit about that, your colleague with Senator Cassidy earlier as well. But I'd say that we have seen a number of these outliers. Costa Rica has the highest life expectancy along with Chile and Ecuador in North and South America, except for Canada. They're at 82, again, compared to our 79. Thailand, which has been receiving support from the US government for advancing their health system, made a focus on investing in primary care. And what do I mean by that? That means that they have a high percentage of their national expenditure on health going to primary care. In many countries like Thailand, Ethiopia, Costa Rica, it's 30, 40, 50% of the budget going there. We're at 8% in the United States.
Say those numbers again.
Well, so I'll give the most extreme example.
Yeah.
You'll see Costa Rica is over 30%, right? Going to primary health care. You'll see in Ethiopia, a country that made a commitment starting 20 years ago that they would invest in community-based workers that could touch every household at least once a year. So it's not just people sitting in a clinic. This is the critical component about primary health care. What we mean by primary health care is not just that there's a family physician sitting in a box waiting for you, but that there is also an outreach worker, a community health worker, who touches every home, because some large percentage of society in the United States, it's north of 20%, are disconnected from the healthcare system, have no regular point of contact. In other countries, it can be 40 or 50%. And having that outreach capacity with some health education, preventive remedies, vaccination capability, and assessing needs and saying, hey, you're pregnant, you need to come in now to get into your primary healthcare system and receive the appropriate care. Or you have incipient Alzheimer's and you're disconnected from the system and no one is helping you. That is what, in Thailand, for example, have them now matching US life expectancy, being freed from most foreign assistance around global health, and they have a 79-year life expectancy on $300 per person per year for health care. We spend $13,000.